Good morning. We want to thank the media representatives who have joined us for today's news event. My name is Kathy Dix-Payton, Media Relations Manager with the Department of Health and Community Services, and I will be the moderator for the question and answer session. Joining us today are the Honorable John Hagee, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly. Conference will begin shortly.
Good afternoon, and thank you for joining us today. I'm here today to fulfill an undertaking I made, hoping that I'd be able to do it on Friday of last week, but unfortunately I couldn't, so I apologize for the delay. This is about the analysis of the rotational workers pilot scheme that we undertook some months ago. I'd like to thank Quality of Care Newfoundland and Labrador for undertaking the review. To remind people, this review pertains to Newfoundland and Labrador residents who rotate to Canadian work camps and work sites. International rotational workers are governed by federal jurisdiction and the Quarantine Act and are outside of this. The review, which will be posted on the website later on today, shows our cases are related to travel and we have done a very good job of keeping our numbers low. The Atlantic bubble, I think, has served as well. But we have looked and continue to look at what's going on around the rest of the country. On Saturday, there were 1,015 new cases in Ontario. There were 1,064 in Quebec. There were 349 in Manitoba. And Alberta set a record for active cases on Friday of last week. In addition to that, Canada has been removed from the safe fly list into the Schengen area of the European Union, and Britain, the United Kingdom, is going into a lockdown for 4 weeks as of last night. Our data do show that we have been successful in containing those cases that have been associated with travel. There's been no community spread. Our goal was never to have no cases. That is unrealistic. Our goal was to contain those cases we identified. I'm happy to say that the report, the analysis, shows that we do not need to be more restrictive with our rotational workers than we are at present. The review also shows there is really no room to further relax the existing policy. And so in the light of this analysis, it's been decided that there will be no change for those rotational workers who live in Newfoundland and Labrador who work on Canadian camps and sites. I know the general public may be concerned about that, but I would encourage you to look back to the science that guided us to the Atlantic bubble. At that point, I think 80% of the population said this was a bad idea and we shouldn't do it. As of a couple of weeks ago, 70% of the population now think it's a good idea and they don't see an issue as long as our safeguards persist. We have been guided by the science, and I would urge everyone to continue to be guided by the science as we make decisions to try and keep the bulk, all of Newfoundland and Labrador as safe as possible. I think having said that, we do need to acknowledge the challenge that rotational workers have. It is a difficult lifestyle. They do it for their families, and they do it so they can keep roots here and their families can grow in this province. I think we also need to remember Dr. Fitzgerald's comments about kindness. Their family members are in need of our support, not our condemnation. I understand that these have been challenging times for rotational workers. We do have supports in place. We are better equipped, I would argue, in that regard for mental health than any other jurisdiction in Canada. And I would suggest that anyone who feels challenged emotionally by their situation reach out for help, either online or through the phone or in person at one of our Doorways clinics. So to recap, for those rotational workers, Newfoundland and Labrador residents who work in a Canadian camp or site without an outbreak, they can come home, they should isolate, call 811, and between days 5 and 7 seek a COVID test. By day 7, if they have completed 7 days, have a negative test and no symptoms, then they are free to go. They should avoid large gatherings and prolonged contact indoor public meetings, but other than that, there are little or no restrictions. Again, this does not apply to those individuals who are coming from work camps or work sites where we have been notified of an outbreak. They are obliged to do 14 days of self-isolation unless they develop symptoms, in which case they should call 811 and seek guidance and, if necessary, a COVID test. So with that, I will pause and hand it over to Kathy to see what questions we have from the media. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Jackson of The Telegram. Please go ahead.
Hello.
Good morning.
Yes, thank you. The report makes reference to other countries that conduct testing immediately upon entry as part of the regime. Why has this province never followed that policy?
So right now we have isolation when people come in, so we don't need to test immediately upon entry. A test at days 5 to 7 certainly would be a little more sensitive, given people time if they are incubating the virus to do exactly that. So You know, the places that tend to test on entry are looking at alternatives to the isolation in that initial, like if you're thinking about Iceland, initially they had let people not isolate if they had a negative test. So right now we're isolating people, so the need for that test is not really there.
Okay, thank you. And is there anything that's happened since the period of this report that would cause you to revise your conclusions in any way, thinking of the past couple of weeks?
At the moment, no. We're, you know, the conclusions that they have is certainly, we certainly agree with maintaining things the way they are.
Okay, thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Question specific to the report. I'm looking at the flow charts, and they're showing calls to 811. There were a certain number of calls, and there were 0 positive results from that. But then on the flow chart below, it says there were 2 rotational workers who tested positive. So can you just explain to me what those graphs are showing? If we had 0 positive tests, but then the next one we're showing there were 2 rotational workers who tested positive.
Yeah, thank you very much, Peter. That's a good question. I mean, from our point of view, the testing was not done on the basis of symptoms, and therefore I think that's where you see the discrepancy. These are routine tests, simply arranged because they were rotational workers who fitted into the category.
Sorry, so does that mean they didn't? Was that private testing that was then done to find these cases, or because that first chart, the 2,176 individuals, would that not include the rotational workers who are calling up to get their test after 5 days of isolation?
So the first flow chart, that is actually all of the rotational workers that called 811. And there were, as you can see there, 1,850 individuals, and there were no positive results in that. In the second chart, they're looking at our travel-related cases. The ones that are marked rotational workers, one of those actually did not fall within the study period. They were tested before the study period occurred, and the other one was not identified in that 811 data. So they presented, they either didn't call to arrange testing, or they called 811 but didn't provide information to identify them as a rotational worker at that time. So that's the reasoning for that.
Okay, thanks.
So when we looked at, these were the people that were provided through the methodology that was developed for the study.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
Hi there. I just have a question about clarification. The final page of the report, conclusion number 1, the last part of that sentence says the incidence in rotational workers exposed to the policy was 0. Can you just translate that into, I guess, normal English? Because I don't really understand what that means.
So basically, they're saying that the incidence, which are the number of new cases during the study period in rotational workers, was 0.
Okay. And I just want to be also hyper clear on one other thing. Obviously, this has been, you're looking at this as a success. Are these, less strict rules for rotational workers going to be in place until further notice? Because we were talking about this as a pilot project.
From our point of view, I mean, these are measures that we have validated by evidence. I think should the situation change, we would obviously want to look back and see what other measures we could do if we started to see a rise in cases. One of the real concerns that we look at is the epidemiology, the number of cases elsewhere in the country. And that's why I preface some of my remarks with those numbers from the weekend. We do not exist in isolation here. And the rotational worker element is different in the sense that it is both exposing people to travel and therefore the risk of the virus, but they are going to significantly controlled areas from the point of view of a work site or a camp that are not typical of, say you or I if we went to visit family in Alberta or BC. So we walk that balance between recognizing the environment in which rotational workers work, their challenges around interactions and mental health, but also the risk of the public's general health, because at the moment it certainly does look like the only way we're going to get significant cases in this province is if they come in from outside.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. I'm just looking to clarify on Patrick's question there. So this program is going to remain in place?
Yes.
Thank you. And having seen the success from this program, and you say if things were to change, but we've heard from a lot of rotational workers that this program doesn't work for them because their turnarounds aren't 14 days. They tend to be shorter periods of time. Have we looked at, I guess, in ways of adapting for those rotational workers whose turnaround is shorter?
We certainly do understand and the difficulties that rotational workers have with regard to travel, and it's a difficult way of life outside of COVID, I think, and even COVID makes it more difficult. But in public health, we are charged with being able to protect the health of the whole population and the risk of importation of this virus, and we have to strike the balance as best we can. So this is where we have come down and finding the best balance possible.
Thank you.
Our next questions are from Allison King of VOCM News. Please go ahead.
Hi. What is the uptake on the mental health services that you have for rotational workers?
Thank you. It's a good question. We can't actually break that down by rotational worker or category. We do know that we've seen a significant uptick in traffic to Bridge the Gap, for example, as a portal. I think the last set of figures I saw was a 400% increase over baseline. That breaks out into different ways depending on which apps or programs on that page are utilized. But we do not have the data to be able to say, half of these are rotational workers or half of these are employed persons within the province. I'm not sure how we would actually go about collecting that data prospectively without introducing another layer of bureaucracy and potentially a barrier. The whole issue about Bridge the Gap is being low barrier, ease of access, and kind of non-judgmental, non-discriminatory. So that's, again, another balancing act.
Thank you. And when it comes to this policy staying in place for, until we hear word otherwise, what would it take for that policy to change, either stricter or lessen some of those restrictions on rotational workers?
So certainly if we were seeing more cases that were coming from rotational workers, we would have to think about that, and it'll depend on outbreaks in work camps, and if there was significant change in the way that work camps were being run, which, right now, certainly we're seeing quite a lot of policies and procedures in place to reduce the risk of COVID from getting into the site in the first place, and then from spreading should one get into the site. So we would have to see that, and then obviously, as always, we would be looking at our own epidemiology as well, and if we were seeing changes in that, then we would have to react accordingly.
Our next questions are from Peter Jackson of the Telegraph.
Hi. The success of this pilot program would leave a lot of people wondering why don't we just do it with everyone? Why can't other people who are coming here from outside just get a test and be free after 7 days?
So that it's a good question, but at this time, we do know that the incubation period of this virus is 14 days, up to 14 days. The more people that there are people who will test positive and become infectious after the 7-day mark. And we certainly want to reduce our risk of importation as much as possible. This is one group that we felt were, because of restrictions in place, were being particularly hard done by, I guess, by the pandemic. And we wanted to try to balance their wellness with public safety. If we were to allow everyone to do this, there would be an increased risk that we would have people getting in after 7 days who were infectious, and there would be that many more people that was a possibility. And so, we have to once again strike that balance, and so the risk with more people coming in would be significant. Well, would be higher, and not really where we would want to go at this point.
I think the other piece around that, to be fair, is where these people are coming from, and that's been my comments all along. These individuals go to work camps and work sites which are not the typical environment that you would see for a more casual traveller, shall we say. Those people travelling for family reasons or for other do not go through the kind of screening and monitoring that rotational workers do when they're on their job site. So I think that was also a significant mitigating factor in looking at how we could change things to make their lives a little less difficult. That does not apply to everybody else.
Okay, thank you. My favorite word in the report is recrudescent. The recurrence of COVID-19 outside of the Atlantic province has not apparently translated into cases here. So I'm wondering whether there's going to be more focus on the local epidemiology in other places as opposed to broader concerns about growth in the whole province.
So you mean, are we going to be looking at where in each of the other provinces? Yeah. We look at that all the time. We certainly look at where things, our epidemiologists look at what's happening across the country and, what's driving the numbers in other provinces. That's something that they do routinely. So we are always looking at that. But we have to look at, with regard to travel, we have to look at where our travelers are coming through. And often it is through these hotspots areas anyway. So we do pay attention to that on a regular basis.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
I just want to follow up on the question around timing. You said people could develop the disease after or up to 14 days. The study found that everyone was diagnosed within 8 days of arrival. So doesn't that mean we could be shortening our quarantine period?
Well, no, because it was only 13 people. So, we have to look at the total, and we have to look at that in larger numbers than just the number of people that we have here. And we also have to remember that some of those people who were diagnosed were not symptomatic, but were identified as contacts of cases. And so, if we had waited for them to be symptomatic, they may very well have been later than the 8 days. So it's not, you can't take that conclusion away from that data.
So can you give me an idea then, how many people have we seen in this province that have been testing positive between 7 days and 14?
We certainly have that information. I don't have it right with me right now, Peter, but if you certainly you can connect and we can get that information for you.
Okay, that'd be great. Thanks.
Our next questions are from Patrick Butler of Radio Canada. Please go ahead.
I want to come back. We're talking about mitigating risk, obviously. Sorry, I'm going to restart my question. Why not take, if we're talking about mitigating risk, why not take a more nuanced approach, where you're looking at, different areas of Canada, places that have less of a prevalence of COVID. That's been suggested a few times, but, if it's really about mitigating risk, then why not take a more nuanced approach?
I think logistically that's a bit difficult to do. Those areas change all the time. We've seen, in the past week, Winnipeg has become more of an issue. That wasn't an issue 2 weeks ago. So you're talking about then changing the rules every week, every 2 weeks. It does make things more difficult to manage from a border patrol. That's not the right word, but from that point of entry. Point of view. So it's not as easy as just looking at where people are coming from, because that information changes quite quickly. So we're trying to, we try to be as refined as we can, but sometimes it's difficult to get right down to that level.
And a question for Mr. Hagney. Earlier you talked about casual travelers versus people traveling for work. If we take a long-term view of this, if in a year's time or if in 6 months' time, all of these measures are still in place, do we have to have a conversation about what casual travel means and when sort of family reunification and things like that come into play and how they could have an incidence on these rules?
Oh, for sure. I still have a granddaughter in BC I've not got to see yet. That was supposed to happen in April, and I'm still waiting for my money back from WestJet, but we won't go there. The issue from my point of view has always been that this is going to be a really trying exercise. It's going to be long. It's a marathon. It's not a sprint. We've seen in the beginning pandemic fear. That's gone to pandemic fatigue, pandemic frustration, and now in some areas even pandemic anger, a resentment that we have to change the way we do things. There are technological leaps you can use, Skype, FaceTime, those kind of things to connect with family. But at the end of the day, for compassionate grounds, we do have exemptions that are available for families. We did in the summer, and still do, have exemptions for caregiver and support and these kind of things. But I think it is about containment. It's about reducing travel. The challenge our tourism industry faces is even absent travel restrictions, no one's flying. You look at the jurisdictions that are out there that don't have any travel restrictions, and the load factors are really below those that the airlines can support. So I think there is a huge awareness in the general public that they have to do things differently and wait until the tide turns. The next key is a Canadian vaccine that is safe, that is effective, and that it's widely taken up. And that will then allow us to move from containment in the way we have at the moment. But it's a marathon. There isn't an easy answer. You're quite right.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. With the success of the project, we know that there are other rotational workers that come to the province for family reasons who aren't deemed a resident of the province. They don't have an MCP card. Are we looking to change the grounds for their criteria of being deemed a rotational worker?
Not at this time, no.
And how much of this report will weigh into the Christmas Squad feelings when it comes to looking what Christmas will look like during the pandemic?
So I think, the Christmas Squad has been working diligently. I'm sure they'll look at this and use it to inform some of their decisions. I'm not privy to all of their conversations or meetings, so, but I expect that they will use it to help make some decisions.
Thank you.
Our next questions are from Allison King of VOCM News. Please go ahead.
Hi. What have you guys learned from Alberta's pilot project where they're testing rotational workers at the border, and is it that effective enough for us to be doing that here?
Are you talking about the pilot project that was announced last week, or?
Yes.
Yeah, so that's actually just starting today. So, you know, there's nothing to learn at this point, I guess, but, you know, certainly we'll be interested in the results of that when it comes out. But at this point, you know, it's too early to really say anything.
Perfect. That's it for me.
Peter Jackson, do you have any further questions?
No, I'm good. Thanks very much.
Peter Cowan,
I'm good, thanks.
Patrick Butler,
No, thank you.
Kellyanne Roberts.
I'm just wondering, are we still having another briefing this week, or does this take place of that?
My understanding was that this is to keep a promise I was a bit late with from Friday for reasons I couldn't control. So my understanding is that, you know, Wednesday would still be on.
Thank you.
And Allison, did you have anything further to ask?
No, I'm good. Thank you.
Thank you very much, everybody, for tuning in. Minister, did you have any final comments?
No, thank you, Kathy. Thanks for running a tight ship as always. And as I say, we'll advise of a time for our regular slot later on in the week.
Thank you very much, everyone.